Informed consent prior to immunization. Consent for series process. Adult immunization. Client does not demonstrate capacity to provide consent. May 2013. Health clinic visits involve complex conversations, including informed consent, health assessments, and other health issues. There is a difference between obtaining informed consent to immunize and deciding to do the actual immunization. The health assessment and eligibility and contraindication determination are aspects of the decision to immunize using clinical judgment. These are all outside the scope of obtaining informed consent. The purpose of the following demonstration is to show how a vaccine provider can use their skills to assess adults who present for immunizations with unique cognitive and communication abilities. The client who presents will be assessed as not capable to consent for self. The process for obtaining informed consent consists of 7 steps and is outlined in the BCCDC Immunization Program Manual, Chapter 2. Step 1. Determining authority.
Good afternoon, my name's Jessica. I'm a registered nurse and I'll be doing your immunization today.
Hi, my name is Anne. This is Ginger. I work at a group home and I brought her for her flu shot today.
Hi, nice to meet you, Ginger. I'm a nurse.
Yeah, Ginger has a limited capacity. She can say yes or no, but she's not always consistent and we're not sure if she understands what she's saying yes and no to.
Thank you for sharing that information with me, Anne. It's really important for me to know that. So for me to be able to give the flu shot today, I need someone who's able to give consent. Are you able to do that for Ginger today?
No, sorry, I can't. But I did bring a consent form that her guardian signed for us.
Perfect. I'm so glad that you brought that. All right, so what I'm going to do is I'm just going to talk about influenza and the flu shot, and then we'll see if we actually do need to use the consent form that you brought today. So Ginger, I just want to review this health file with you. It's a HealthLink BC file, and it tells you about what the flu is and what influenza shot is for, what it protects you against.
Step 2. Assess capability. As with all adults, the vaccine provider approaches Ginger with the presumption that she is capable of making her own decisions. The vaccine provider is responsible to continue assessing Ginger throughout the appointment and engage Ginger as much as possible. To assess Ginger's capacity to consent for herself, the vaccine provider goes through the process of providing standard information. This includes benefits and risks of receiving the vaccine, the common and expected side effects, the possibility of serious or more severe adverse events and how often they occur, and any contraindication to receiving the vaccine. Providing the standard information provides an opportunity for the vaccine provider to assess Ginger's capacity to provide consent. Step 3. Provide standard information.
Ginger, when we talk about the flu, basically it means when someone gets sick with a virus and it gives them a cough with a fever. Does that make sense? Why we want to give you a flu shot is because it's going to protect you against getting sick. Are you understanding what I'm saying, Ginger? Are you well today, Ginger? Are you healthy? Do you feel sick at all?
Yeah, Ginger is well. We made sure that she was healthy before we brought her out.
Thanks for that, Anne. Do you have any allergies, Ginger? Ginger, are you allergic to anything?
No, Ginger doesn't have any allergies.
What about a flu shot? Did you have a flu shot last year? Did you have something in your arm, Ginger?
Yeah, Ginger gets a flu shot every year. I've been working with her for 5 years and she's never had an adverse reaction.
The vaccine provider assesses that Ginger does not have the capacity to consent for the flu shot. The vaccine provider will ask the caregiver for the consent form.
All right, and I think at this point it's probably best for us to stop going through the health file and actually use the consent form that you brought with you.
Okay, here it is.
Thank you.
Step 4. Confirm understanding of the standard information. The vaccine provider stops and assesses the situation. Ginger does not answer any questions. She is not engaged, and Anne answers all of the questions for her. Ginger demonstrates she does not have the capacity to make an informed decision to consent to the flu vaccine today. Anne does not have the authority to consent on Ginger's behalf, and Anne does have a signed consent form. Let us review the 7 steps of informed consent in regards to the current situation. 1. Determine who has the authority to provide consent. When an adult presents with a signed consent form, the vaccine provider first approaches the adult to obtain consent for the vaccination. Adults have the authority to give, refuse, or revoke consent for their own vaccinations. Adults are presumed capable of making this decision until it is demonstrated otherwise. 2. Assess the client's capacity to give informed consent. During the interview, Ginger demonstrates she cannot consent for the flu vaccination herself at this time. Ginger does not engage, shows no discrimination between questions. Ginger does not show evidence of processing the information given to her. 3. Provide standard information. When the vaccine provider presents the standard information, Ginger does not seem cognizant. The vaccine provider does try to communicate effectively with Ginger by allowing time for her to process the information, trying to get eye contact, using her name and plain language, and drawing on the assistance of Ginger's caregiver. 4. Confirm client's understanding of the standard information. Ginger's behavior does not demonstrate understanding. As the vaccine provider is not able to confirm understanding, she is unable to obtain informed consent from Ginger directly. Steps 5 and 6 of the informed consent process will not be completed with Ginger. If there is no written consent for Ginger to receive the flu vaccination, the vaccination needs to be deferred until informed consent is obtained. The vaccine provider must now proceed to use the consent form brought in by Anne.
So I just need to look through the consent form and just make sure it's been filled out. So I'm just seeing here that it's been signed by a personal guardian. It's been signed recently, in this month actually. That's perfect. We can go ahead and use this. What we do to give the flu shot is we can give it in the right arm. We'll need to roll up her sleeve or just take that part of the sweater off, and then I'll clean the arm and we'll get started.
Okay, Ginger, you're going to get a poke in your arm. The nurse is going to give you a shot, okay, for the flu shot.
The vaccine provider is able to proceed with the vaccination, and the caregiver knows to bring in a signed consent form as she does not have the authority to consent for Ginger on her behalf. An immunization consent form can be signed by a substitute decision maker such as personal guardian, representative who is named in the representation agreement and who is designated to make healthcare decisions on behalf of the adult. Temporary substitute decision maker, as long as the informed consent is signed within the last 21 days. There is detailed information about the temporary substitute decision maker on the back of the consent for influenza vaccine for adults assessed as incapable of giving informed consent. Step 7. Document consent or refusal. The vaccine provider signs and dates the consent form and files it according to health authority guidelines or practice area. Ginger, the client, receives proof of immunization according to health authority guidelines or practice area. The vaccine provider provides Ginger and Anne with a copy of the health file and advises if they had any questions or concerns to contact Ginger's doctor and the health unit.